So this is the sequence of our presentation, and I'm not going to waste time going through it. The study, our study aims to examine the social, economic, and cultural processes which affect the experience of anti-Chinese racism and racialization during the COVID-19 pandemic from the perspectives of the Chinese living in the Greater Toronto Area, and using a sociological framework of analysis. I should mention that the research is still ongoing, so we'll only be able to present some background information as well as preliminary findings to you today. And now I will pass it on to Keefer to speak about the context whereby our research is situated. Keefer?
Okay, so when talking about the context, it's important to note that anti-Asian or anti-Chinese racism in Canada has exploded since the start of the COVID-19 pandemic. And while there's great work that highlights how COVID-19 has disproportionately affected racialized communities in terms of both infection rates as well as discrimination, Asians or Asian-looking people have experienced the brunt of racist backlash and stigmatization. Here, for example, crowdsourcing data collected by Statistics Canada from August 4th to the 24th of 2020 shows that among participants who reported experiencing discrimination, Chinese and Korean respondents were among the highest, and that these experiences of discrimination were mostly based on race, ethnicity, and skin color. And this is consistent with Professor Wu and his colleagues' 2020 study that because the outbreak started in China, Chinese and Chinese-looking East Asian Canadians may have experienced more racist attacks, violence, and discrimination. In fact, as Professor Yu had shared in his keynote presentation, the Angus Reid Institute has been at the forefront of looking into anti-Asian discrimination in Canada. And according to their findings in 2020, has found that over 50% of the 516 Chinese Canadians they surveyed experienced name calling due to COVID-19 outbreak. And while 43% note that they'd been threatened or intimidated because of their ethnic ancestry. So this follows with research from the Chinese Canadian National Council Toronto chapter that has found from March to December 2020, 84% of those targeted for racist backlash were of East Asian descent, with 60% of those affected being women. As Professor Wu had highlighted, it's in these higher incidences of what him and his colleagues call acute discrimination that they found higher levels of mental health symptoms among East Asian Canadians. So these statistics and findings reiterate the fact that anti-Chinese and anti-Asian racism during the COVID-19 pandemic is a broad issue with many intersecting factors in relation to a history of othering people of Asian descent. Recent work has emphasized that the rise of anti-Asian hate crimes and the experiences of discrimination during the pandemic are also rooted in historical and institutional structures that are xenophobic, exclusionary, and reinforced. Coloma argues that Asians in Canada occupy a paradoxical and liminal space in Canada in which their labor and capital as immigrants, workers, and students are desired and recruited when they benefit the Canadian economy, but are undesired and rejected when their presence is seen to challenge the status quo. Keel and Ali add that the relationships between urbanization, disease, and racism have a long-standing history on the stage of a colonial settler society in which visible minorities have been largely invisible as active participants in Canada's national history. Researchers have also noted that the persons of Asian descent, as well as other minority groups in Canada, depending on social and geopolitical context, have been scapegoated for incidents of national unrest and their citizenship and belonging to the Canadian state continually challenged. And COVID-19 provides yet another instance in which the Canadian multicultural ideal of tolerance and diversity is tested. This is borne out by findings from Statistics Canada, in which victims of racial discrimination report overall lower trust levels in institutions, as well as weaker feelings of belonging to their community. Very much related to what Professor Yu had said in his keynote presentation on the historical foundation of non-belonging. Still, research on the effects of COVID-19 on the Chinese Canadian community in terms of social and economic well-being due to anti-Chinese and anti-Asian racism, as well as research in general on the pandemic in the Canadian context, is still severely lacking. And this is where our research data will help to fill in these gaps. Our study will enhance existing research and literature by adopting an intersectional approach to examine the experiences of racism on the Chinese residing in the GTA, and to explicate how macro and mesostructural processes have impact on racialized communities such as the Chinese community before and during COVID-19. Okay, I'll now pass it back to Guida for the conceptual framework and methodology.
Thank you, Keefer. So the conceptual framework and methodology of our study is informed by the literature on the intersectionality of gender, race, ethnicity, and class, or GREC in short. GREC intersectionality is embedded in processes such as immigration or the labor force, which shape the everyday experiences in an indeterminate way. The study puts the lived experiences of individuals in the Chinese communities at the center of the inquiry and links their subjective accounts of their experiences of racism to the larger social, economic, political, and cultural processes in which their experiences are embedded. We employ in-depth interviews as our primary data collection tool in our research design. Our research subjects are persons who self-identify as ethnic Chinese. The research sample includes 8 men and 8 women residing in the Greater Toronto area. We have not embarked on detailed data analysis yet, but we intend to use either in vivo or max QDA to organize and analyze the interview data. And now I will pass on to Ernest to talk about recruitment process and some demographic data regarding the interview participants. Ernest?
Thank you, Guida. To recruit participants for our project, we reach out to our community partner, the Center for Immigrant and Community Services, also known as CICS. In addition, we contacted the Chinese Canadian National Council Toronto chapter, or CCNCTO, to assist us by posting recruitment flyers on the social media platforms. We also make social media posting in 3 popular Facebook groups favored by people of Chinese descent, as well as some other multicultural community groups. Lastly, we reach out to our personal connection and use snowball samplings. There were many people who contacted us, but we were not able to include them because all spots have been filled. In total, we conducted 16 in-depth interviews in Zoom. Each interview lasted between 1 and 2 hours. The interviews were conducted in English, Mandarin, or Cantonese. So here is a table summarizing our participant demographic information. In terms of the participant age, most of them were below 49 years old, with the exception of 1 female and 2 males who were 65 or above. 1 participant declined to provide his age. Half of the participants were born in mainland China. 5 of them were born in Canada, and the remaining 3 were born in Hong Kong. Amongst those who were born outside of Canada, almost all of them came to Canada between 2000 and 2021, so they were mostly new immigrants. At the time of the study, 10 of them were Canadian citizens, and the other 6 were permanent residents. 2 participants self-identified as LGBTQ+. In terms of marital status, the majority of participants were single. Our participants were also well-educated. Almost all of them have completed post-secondary education. At the time of the study, 10 participants were employed, 3 of them were unemployed, and the other 3 were retired. The majority of our participants reported an annual personal income that is below $70,000. 2 participants reported earning $70,000 or above. This range of personal income might reflect that most of our participants were young, single, and recently graduated from university. Similarly, in terms of family income, most participants also reported an annual family income that's below $70,000. 3 participants reported an annual family income that is $70,000 or above. Information on family income was not available for 4 participants because they were single individuals or because they declined to provide information on their personal and family income altogether. I will now pass on to Victoria to talk about the experiences of racism before and during COVID.
Thank you, Ernest. So, experiences of racism before COVID. Some commonalities in terms of experiences of anti-Asian Chinese racism prior to COVID-19 were reported by respondents. There were frequent reports of covert and overt racism in the workplace. For example, a home support worker was repeatedly assigned to different homes as the client specifically requested that they didn't want a support worker of Chinese background. There were also reports of a glass ceiling in terms of lack of advancement in the workplace if one was Asian. Other common forms of racism include verbal aggression and microaggressions. For example, derogatory remarks were made to them, such as being called stupid, assuming that they didn't speak English, and being heckled in public. A common question they often get is, where are you really from? This form of microaggression perpetually others Asian people due to their physical appearance. There were also reported experiences of racism in schools. Participants recalled being bullied in elementary school by other children for being Chinese, for looking different, for the foods they eat, or if they had trouble fitting in. The idea of being second class is so deeply internalized that many of their experiences were normalized and were not noticed nor analyzed in more depth by the respondents until they got older. Finally, many have tried to live up to the ideal of the model minority. The model minority myth is the idea where if Asians are doing well economically, this means there is no racism in our society. Experiences of racism during COVID-19. There were some common experiences of anti-Asian Chinese racism reported by respondents during the pandemic. One was that face masks were reported as a source of racism in the beginning months of COVID-19, where anti-Asian Chinese racism was targeted at those wearing face masks in public. Anti-Asian Chinese racism frequently occurred in public spaces, such as on the street, in public buildings, in shopping malls, supermarkets, at home, at school, and the playground, with public transit identified as a particular hotspot of racism. Respondents reported ostracization and avoidance by neighbors, as did their children in the playground by other parents and children. Verbal aggression was common, such as being cursed at or told to go back to China. There was frequent scapegoating of Asians where they were seen as carriers of COVID-19. Needless to say, all of these attacks, whether verbal or physical, were unprovoked. Racism in the workplace remained a frequent occurrence. In 3 cases, for example, one participant was removed from his office and was allocated to work in the hallway all by himself. Another respondent was the first person to be fired from the company at the beginning of the pandemic. Some women reported being scared to go out alone as they were scared of being harassed and assaulted on the streets. One woman, to combat this, never left the house alone, never left at night, and was always with her roommate. She also stayed away from Chinatown for 6 months due to the fear of an unprovoked attack. A startling revelation is that no one intervened when racist incidents occurred. When passerbys in public spaces or other passengers on public transit did not intervene during these incidents. I'll now pass it on to Elena and Guida to speak about the case studies.
Okay, so we'll now present 2 case studies to illustrate how racism interacts with gender, ethnicity, class, age, citizenship status to reproduce inequality. And we have chosen 2 participants, Kay and Lucas, as they are very different in regard to their intersectionalities, and they also have diverse backgrounds and circumstances. So Elena will talk about the 2 case studies. Go ahead, Elena.
All right, so the first case is Kay. Kay is the pseudonym for a middle-aged married woman from mainland China who immigrated to Canada in the early 2000s to reunite with her husband. When she first arrived, Kay was a stay-at-home mother who did not work outside the home, and because of this, she contends that she did not experience much racism during this time. She's of working-class background with just a high school education from China. So Kay currently works as a home support worker. She doesn't speak English very fluently and does so with an accent, but is competent in meeting her clients' needs and communicating with them. She likes living in Canada as it is a multicultural country with people from all different racial and ethnic backgrounds, although she does believe that there is a hierarchy in Canadian society with white people at the top and racialized people, such as the Chinese and other Black, Indigenous people of color occupying lower positions on this hierarchy. In terms of the racism that Kay experienced prior to COVID-19, when she first started working as a home support worker, she experienced overt racism several times a week. She was working for an agency run by white folks, where she was assigned to go to clients' homes to care for elderly adults from different racial and ethnic backgrounds. Some clients called her stupid due to her lack of fluent English, while others would let their dogs out to prevent her from entering the homes and then telling her not to return there again. She worked for that agency for a month, and while Kay didn't launch any complaints, she was upset and opted to leave before finding work at another institution that serves primarily Chinese clients. Since then, she has not experienced any racist incidents at work and has supportive coworkers to whom she could relate her experiences of racism. In terms of racist incidents that took place during COVID-19, Kay mentioned two in her interview. The first occurred at the beginning of the pandemic when she was shopping for groceries with her husband at a supermarket in Scarborough. As they were engrossed in their shopping plans, they neglected to notice the arrows on the floor that directed customers, and they accidentally clashed with a white male who screamed angrily at her and her husband. Although he didn't make any racist slurs, she did feel quite a bit of hatred coming from him and was convinced that the incident was related to the fact that they were both Chinese. And as a result, she and her husband quickly left the store. The second incident occurred when she was driving to pick up groceries after work one day. At a red light, a white woman in the car next to her yelled at her for being Chinese and questioned why she was wearing a face mask. She further accused Kay and other Chinese people of bringing COVID-19 to Canada. Similarly, at the beginning of the pandemic, when Kay was caring for older adults at her first agency, some of the clients also accused Kay and other Chinese of bringing COVID-19 to Canada. So that's Kay. I'm going to move on to talking about Lucas, case 2. So Lucas is the pseudonym for a second-generation Canadian male born in Canada whose parents immigrated from Hong Kong. Lucas is university educated and works as a project manager. The fact that he grew up in Canada, his youth, and his solid middle-class, upperly mobile background enabled him to feel more confident in himself compared to Kay. And at times, he's able to laugh off racist incidents or insults or even confront them directly. Before the pandemic, Lucas experienced racism at a parking lot in a Midtown Toronto mall. Before he got out of his car and without any provocation, a white male in his 20s or 30s approached his car and yelled at him that his driving skills were bad. Lucas was incensed and retaliated by yelling back at him while walking towards him and a woman he assumed was the white male's mother. When confronted by Lucas, the white male made another racist comment about Chinese people and bad driving before driving off with his mother. During COVID-19, Lucas recounted two instances of anti-Asian racism. The first occurred outside a restaurant in Markham. While waiting in line for takeout, a hulking middle-aged white male in a suit told Lucas to back away from him, even though Lucas had maintained a safe distance, saying that Lucas and his girlfriend have COVID-19 and would infect him. It wasn't clear if the person was paranoid or was trying to pick a fight, but Lucas decided to laugh it off as he didn't want to confront him. While other customers of the restaurant called the person out, the white male reacted by quickly leaving after he got his food. Another incident happened in Lucas's former workplace at a large international company in downtown Toronto. One of the executive directors at that workplace asked Lucas to prepare a presentation based on the South Korean film Parasite, which, as many of you already know, was critically acclaimed and won many awards, including Best Picture and Best Director at the 2020 Oscars. However, the day before the presentation, the executive director told Lucas to remove all themes and references related to the film, as the Asian characters in the film reminded the executive director of COVID-19. Lucas and his supervisor were very shocked by this comment. And now Guida is going to talk about a deeper analysis of these two cases and all our cases.
Thank you, Elena. So actually, these are just preliminary analysis of these two case studies. As we can see, racialized people always experience racism, whether it's before or during COVID-19. It is evident from these two cases that we just talked about that these individuals, their experiences of racism intersect in complex ways with their various identities to reproduce inequalities such as targeted racist attacks. At the same time, their intersectionality also complicates how they utilize their agencies and in order to combat racism. As was discussed, many racist attacks occur in public spaces. And both Kay and Lucas experienced racism before and during COVID-19. They experienced both covert and overt racism. However, during COVID-19, the racist incidents are directly related to the fact that they are Chinese or they look like Chinese, and therefore are seen as virus carriers. They are shunned, attacked, and vilified as a result. Kay and Lucas utilize somewhat different strategies in dealing with overt and covert racism. Likely, it's complicated by their different positionalities. Being a middle-aged immigrant woman with limited English language skills and working as a low-level caregiver serving elderly adults and having only a high school education from China with little Canadian experience. Kay deals with racism silently. Her model is to keep quiet and make peace with everyone and hope that everything would be all right. Lucas, on the other hand, deals with racist events differently. Depending on the situation and the place, he either confronts the person directly or laughs it off and not treat it seriously. Growing up in Canada with a keen awareness of being different and being marginalized, Lucas is strategic in how he deals with racism. The fact that he is a young male who is physically fit, he is more able to stand up to racist acts by confronting the perpetrator. He is also likely to be less vulnerable to certain racist attacks, whether verbally or physically. The informal support he received from family and friends also mitigated the impact of these racist incidents he experienced. When confronted with institutional racism in the workplace, however, both Kay and Lucas reacted in a similar way. Despite their different locations, both kept quiet without complaining to higher authorities, likely because of the fact that they're afraid of losing the jobs. As well, they're also acutely aware that institutionalized racism in the workplace is so deeply entrenched that they are powerless to call out racism, particularly when they understood that those in power would not protect them, nor would they address the issue. They both opted to change the jobs rather than challenging the institutional policies and practices. So while both of them are proud of their Chinese heritage and identity, they also attribute their cultural traits as one of the reasons for being a target of racism. They maintain that Chinese culture encourages them to keep quiet, to keep their heads down and not make any waves. So their internalized racism may have been in some ways reinforced by deep-seated ideology and stereotyping of the Chinese in Canadian society as docile and compliant, and exacerbated by the historical and contemporary racist and sexist processes, which perpetuate their marginalization and subordination in Canada. Global and geopolitical factors also play a part. Strained relationships between China and Western industrialized countries such as Canada, ignited by trade wars and other economic and human rights issues, are further exacerbated by the pandemic, with the attribution of the virus being originated in Wuhan, China. Furthermore, Trump, the former president of the United States, poured oil on water by calling COVID-19 the Chinese virus. This labeling and scapegoating give others the permission and excuse to launch racist attacks upon those of Chinese heritage or who look like Chinese. Such racist discourses are being reproduced and normalized and continue to perpetuate racism against Chinese people. So in conclusion, I should say that while not a homogeneous group, the Chinese communities in Canada have been joining together to fight against racism in Canada and to demand for equitable treatment since the early years of Chinese immigration. and they continue to do so in the present time. In more recent years, Chinese activist groups have been joining together with other BIPOC community activists in combating all forms of racism against minoritized communities. As expected, the participants in this project are very articulate in their demand for social change. It is hopeful that the result of this study will deepen our understanding of racism and racialization against Chinese or Asians in Canada, and will help to formulate anti-racist policies and practices to combat racism against Asians and other BIPOC communities, as well as in identifying specific social support for those who are or have been the targets of racism and xenophobia. Thank you.